Oh, okay. Good afternoon, everyone. Thank you for being here for the second session of the second day of 5 days online FDP program organized by Malaradi College of Pharmacy. All the three sessions attended have provided good information and useful insights. Now we can proceed to the next session by the Dr. Akondi BUTCHI RAJU sir. Before introduction, sir, I would like to ask my principal, sir, Dr. M. Sudhakar, sir, to speak about few words.
Dr. Ashok from the Kolhapur. In morning also we had a session. It was excellent sessions, completely about the AI in pharmacy, what is required for a pharmacy teacher to meet the present day world. Our just simple knowledge may not be sufficient now. So we have to run for the things, not like earlier. Earlier, of course, only computer science people, they have to update every day, but not like that now. For pharmacy also, the time has come now. We have to update ourselves to sit in the present world, competitive world. That's most important to survive ourselves. So the new syllabus has given information about the Python, analytics, ML, clinical pharmacy, like this, AI in clinical pharmacy, like this. So many terms, terminology is there with the different types of syllabus. So all the faculty, all the pharmacy teachers must be aware of all those things. Now, let us equip ourselves. Let us update ourselves. Let us upgrade ourselves to the present day needs. That's most important. So to have that upgradation, our college started this 5 days FTP. Very beautiful, eminent speakers are getting it. I'm very, very happy. My faculty also are working very well to get the speakers. All well-known speakers and reputed speakers are coming every day. Like that, we have Dr. BUTCHI RAJU garu. And about the college started in 2004, our college. And we have the courses like B Pharmacy, M Pharmacy, and three specializations, pharma analysis, pharmacology, and pharmaceutics, and PharmD, a 6 years course, and PharmD PhD 3 years course. And college is accredited by the NBA for the B Pharmacy course for the last 14 years. And fourth cycle is going on. And we have the NIRF ranking for the last 3 years. This year, waiting for the result. 25, of course, we didn't get it. And this year, we're waiting for the result. And we have this recently IIRF ranking also. And UGC to F, we have it. So actually, we are trying to do something for the pharmacy profession, and R&D activities time to time are trying to do it. And every year, about some 75 to 100 index journals we are trying to publish. So we are making ourselves in the strengthening ourselves in the R&D activities also. And so even very good speakers we are having it. So it will strengthen knowledge of our faculty, not only our faculty, the entire participants of the FTP. And one more thing is that whatever you are speaking here, it's going to the YouTube. YouTube is open to all. So all speeches you can listen at any time. All eminent speakers, all speeches you can listen at any time. That will be very useful. So our people, they got this StreamYard, one new app, they got it. And whatever you speak in that, it's going to the YouTube. So it will be their lifetime. So it will be useful for all. Okay. Thank you, BUTCHI RAJU garu. I request our Sirisha madam to proceed further.
Thank you, sir. It's my privilege to introduce today's distinguished resource person, Dr. Akondi BUTCHI RAJU, sir. Her completed MPharm PhD in pharmacology, who is currently serving as a faculty member, educator, researcher in the development of pharmacology at IBN Sina Medical College, National College for Medical Sciences, Jeddah, Saudi Arabia. He has more than 20 years of experience in teaching, research, and academic administration in the field of pharmacology. His areas of expertise include pharmacology, therapeutics, chemotherapy, clinical pharmacology, pharmacovigilance, and evidence-based healthcare. He has developed the curriculum for the MSc program in pharmacovigilance and clinical research. He has published more than 60 peer-reviewed research and review articles in various reputed national and international journals. He has undergone specialized training AMEE, Dundee, UK, and advanced laboratory training at the University of Kent, Canterbury, UK. He has also served as an editor of the Asian Journal of Pharmaceutical Research and Healthcare, published by Walters Kluwer, and contributes as a peer reviewer for various scientific journals. He received a Best Teacher Award for 25 to 26 from IBN Sina National College for Medical Studies, Jeddah. With all those qualities, makes him an ideal person for this FTP. On behalf of MRCP, I sincerely thank you for accepting our invitation and sharing his valuable expertise experience with us. With great pleasure, I invite Dr. Akkondi Butchiraju sir to take over the session. Over to you, sir. Thank you.
Thank you, ma'am. Thanks to Malareddy Institutions for the wonderful opportunity to interact with fellow academicians from various colleges. And it's my good morning, very good morning, everyone. Good afternoon, I'm sorry. Good afternoon to all. Um, my talk today is about integrating competencies, learning outcomes, and curriculum alignment. So, of course, we can use AI for curriculum alignment. AI actually gave us a lot of scope to align the curriculum, to prepare our curriculums, and to align it with properly with the learning outcomes and competencies. So let me start with a question to all of you. You can, of course, type in the comment section your answer. Many times, we come across students with the graduation, post graduation, and variety of degrees. But unfortunately, the industrial partners or the industries, when we speak to them, many times they're disappointed with the quality of graduates they receive, or the quality of the candidates they receive for the jobs. Where is this problem? Like, what is the problem happening in between the graduation, I mean the colleges and the industries? Like, what is the gap we have? Like, why there is a gap? To address this, we need to start from the first, right? Like, I would like to ask you a question. Like, if you have a student, for example, who is well versed in all the subjects, who is very knowledgeable, who knows everything about the subject, but unfortunately he is not able to communicate well, or not able to express his knowledge, or not able to apply his knowledge to solve certain problems, or to fulfill the job requirements, then that kind of a student may not be fit, or may not be identified as a correct candidate for the job. So even though he's knowledgeable, even though he's well versed in the subject, in all the subjects we have, like pharmacology, pharmaceutics, and so on, maybe he is not able to fulfill the requirements of the job because of his because of the gaps in the curriculum, or because of the improper training. So these things need to be addressed, so that the the graduates are employable, and the industrial partners are satisfied with the quality of candidates they get for the employment. So yeah, this is the in this particular concept, in this particular idea, I prepared a few slides to discuss with you. And of course, you can write in your comments whenever you have any whenever you want to participate in the discussion. Please write in the comments. Okay, so let me ask you, there are, I mean, whenever you come across the quality graduate, or the graduate's ability, right, to perform his jobs, there are four things, there are four pillars for that quality, to make the quality graduate. What are those four pillars? The first one is curriculum, that is the syllabus or the curriculum, like with the composition of many courses, many subjects, with the composition of many lectures or the practicals. So this is the curriculum. And then curriculum and learning outcomes. This is the first pillar. The second pillar is the teaching and learning. What resources we are using, what kind of quality teaching you are doing, and what kind of the infrastructure we have for fulfilling this teaching and learning. This is the second part. Then the third part is the assessment and feedback, like what kind of assessments we are conducting, what kind of examinations we are conducting. So there should not be any mismatch between the teaching and learning, the curriculum, teaching and learning, and the assessment. So if you are teaching something and they need to learn it, of course, and after that the assessment should be related to it, like a practical teaching you are doing. And this practical, when they learn this practical skill, that skill need to be assessed using an objective structured practical examination. So there must be objective for that, there must be rubrics for that. So we need to assess that skill of the practical skill of the student using the assessments which are suitable for that particular training, particular practical. So we need to identify the proper assessments, and then of course the feedback you give to the student and the feedback you receive from the students about quality of teaching and so on. And finally, the outcomes and continuous improvement. So the outcomes can be the university examinations, outcome can be the employment percentage, like how many percentage of students employed per year, or how many graduates are employed. That's a metric we can take. Or we can depend on university examinations, or the college examinations. So based on these outcomes, or based on this examination outcomes, we can try to identify the gaps and try to improve further, and try to modify our curriculum, modify our teaching learning strategies, then assessment and feedback strategies, so that we can improve further. So these four pillars are very important, and out of which the first one is the curriculum. So today we are going to talk or spend more time on curriculum and learning outcomes. So yeah, if you agree with me on this, that there are four pillars for teaching and learning, or if you identify some more pillars, please write in the comments. Okay. So hope you can see the screen, hope you can see the slides. I just changed the slide. Okay, if there is any issue with the audio video, please message here so that I can reply.
Yes, sir. We can able to see the slides. Yes, sir.
Wonderful.
You want me to? No. Yes, sir. We can able to see the slides.
Yeah, okay. Thank you so much, ma'am. Thank you. So then why curriculum alignment matters? Like why we should worry about the curriculum? Why the curriculum is the number one, or why the curriculum is the first pillar in graduating the quality, I mean to produce the quality graduates? Why the curriculum is number one? When it comes to the curriculum, now we need to understand the curriculum from two important aspects. The first one is, what is the student able to demonstrate, what is the student learning, that is starting from the curriculum. Like what are the boundaries of learning, what are the aspects the student learn. So the curriculum gives that boundaries, gives that understanding of learning. Second, the faculty teaching, what the faculty should teach, how much to teach, what to teach, what learning experiences will develop. So this aspect is also part of the curriculum. Then assessments, like what assessments we need to conduct in each subject. Like for example, in pharmacology, assessment of practical assessment is different from the practical assessment of medicinal chemistry or pharmacognosy. So you have different assessments there, and those assessments are properly have rubrics to it, and that is also mentioned in the curriculum. So then program quality, where is the competence introduced, reinforced, So you will write about the competencies, the learning outcomes of the each course, each subject you will mention in the curriculum. So when I'm using this course is nothing but the subject, right? That is the reason why I'm mentioning it. So when it comes to the subjects, the subject learning outcomes or the competences, we also mention that in the curriculum. So when you observe the curriculum, you will find what student is learning, what we are teaching him or what we are teaching the student, and what are the assessments we are conducting in the each particular subject, and finally what is the program quality we have, and what are the competencies we are aiming for, what are the learning outcomes the students need to fulfill at the end of the entire 4 years of or 6 years of program, whether it is post graduation or both of them together, right? So in the entire 6 years, like what they are going to learn. So that program quality depends on the competencies we identify and we introduce in the curriculum. So the curriculum alignment matters to us. Like we need alignment of student learning, the teaching, assessments, and the program quality, all of them, right? So when it comes to the competencies, identify the competencies, prepare them in the form of learning outcome, then identify the topics for the teaching, and then identify the methods of teaching, and then you can go for what learning outcomes you can expect from the student to fulfill, and finally you can prepare the list of assessments also, which are again aligned with the teaching and learning. So these aspects, if you can cover these aspects, if you can align them together and make sure that all of them fall in one single line, then the student who produced out of this curriculum will be employable, will have better chances of employment, and he will be more successful. So for that, the seed or the starting point is the curriculum and the curriculum alignment. So we need to identify the competencies, convert them into learning outcomes, and then we need to identify the teaching learning strategies, assessment strategy or the examination strategy, what you are going to be assessed, what you are going to identify as an assessment, and then how you are going to produce a quality graduate. Okay, so from content coverage to competence, like many times in traditional focus, like if you are a traditional school, traditional college, if you observe, it like topic coverage matters a lot in the traditional setting. Whether lectures are completed or not, that is also what it's also one task to complete, and most of the content is related to the knowledge of the student, test the knowledge of the student, and even the teaching is done in the traditional classroom with one teacher is standing and explaining everything. The student is the passive learner, just listening whatever is given to him, and then he try to reproduce the same at the end of the examination. There will be end semester examination, and in the end semester examination they will just reproduce whatever they learn. This is the traditional setting. In competency based or a competency focused curriculum, we need to identify whether a learner or whether a student learned everything or not. What you are teaching is what the student is learning is more important than what you are teaching. Maybe you are teaching 100%, maybe you are covering all the topics, but if the student is not learning even 50% of it, or if the student is failed to learn even half of it, then we are not meeting the requirements of the curriculum. We are not meeting the requirements of our aim to produce the high quality graduates. So what is more important is how much the student is learning, not how much you are teaching. Maybe you are teaching 100%, but he is learning only 50% of it. So there is a gap between the teaching and learning. Am I right? There is a gap between the teaching and learning. So this gap need to be fulfilled. So how to fulfill this gap? By identifying the gap first of all, and then prepare the action plans. Like what are the changes need to be done? Either maybe the teaching strategy need to be modified. Maybe we need to maybe we need to identify a better strategy, better teaching model, or maybe group discussions need to be introduced. Instead of the bigger classrooms, maybe make them into smaller classrooms, like a small number of people, conducting more quiz-like tests in the classroom itself, right? So that we can improve the students' ability to participate in the discussion, or increase the curiosity among the students to learn better, right? So these aspects, and there are many other aspects which can help us to improve the learning ability of the students, so we can fulfill some of these gaps. And mainly in competency focused curriculum, we concentrate on knowledge as well as the skill, like how much skill they got, whether they can fulfill the task or not, whether they are suitable for the job in the future or not, right? So these aspects also covered here. Attitude, values, their professionalism is also tested in the competency based curriculum. Their professionalism is also tested. Even assessments also we can do in these aspects, like professionalism related aspects. Then application of knowledge, demonstration of performance, like whether they are able to demonstrate whatever they learn at the end of the day. So these aspects, if you can concentrate, that becomes a competency focused curriculum. Now, we need to identify what are the outcomes we have at the end of the day, whether the student is able to practice, whether we are able to assess him properly, whether we are able to give him the feedback at the end of the assessment so that he can learn further, he can learn from his own mistakes, so that we can provide the feedback, not just the marks, but we provide the feedback. This is where the lacuna is, this is where the problem is, so you need to concentrate on this particular task, right? So that you can improve your ability to perform better. So these aspects are covered in the competency based curriculum, not in the traditional curriculums where you have issues related to the skills, or upgrading the skill, or identifying the lacuna, or even the feedback mechanism. So these mechanisms, if you can address, we can make, or we can produce the graduate who is more employable. He can be more successful. So what is a competency? Like, many times we are using this word now, right? I'm just using this word again and again, that it should be a competency based curriculum, or it should start from the competency, right? So to produce a employable graduate, we need a very good curriculum, right? Second, to make a good curriculum, we need to identify the competencies. So what are the competencies required for a graduate after the graduation? What he is going to fulfill, what job role he is going to fulfill. For that, we need to identify the competencies. So from where we can identify the competency, what is the competency? Basically, it is the ability to integrate these elements to perform effectively in real world situation. So if a graduate is able to identify the get the knowledge, absorb the knowledge from the teaching, from the books, and then he learns the skill of application of this particular knowledge, and then he also have a right attitude, and then he also know where to perform, he knows the context of it, right? He understands the full circle. He have the knowledge, he got the knowledge, and he also have the skill to perform the task which is given to him based on the knowledge he get. And then he also have a right attitude, and he also knows where to perform this skill, or the place to perform, or where he can perform. So these aspects, if you can integrate them, right, identify the correct knowledge, identify the skill, identify the attitude, identify the context. If you can identify that, give a name to it, that is nothing but a competency. Right now, this student he is competent to perform a particular task, because he knows the knowledge, he have the skill, and he have the right attitude, and now he knows the context also, right? So he knows the entire full circle. Now he knows the nitty-gritties, the entirety of the situation. Now he's the master of the skill. Now he can perform the job really well. Now this graduate, when he apply for a job, now he is more employable. So that is why this competency based education provide an opportunity to integrate this knowledge, skill, attitude, and the context, all of them. Because of this integration, the graduates who come out of this college based on the competency education will be thorough in their knowledge, skill, attitude, and the context, and they can perform well in the interviews. They can do the job really well, and their life will be, I mean, the success rate will be very higher in their careers. So there are a lot of advantages to this. Now, how to identify this competency, from where we get this competence? I think there is one slide. Yeah. Can you see here how to prepare a list of competencies? Because, now the competencies are important. Like we need to identify the job role and prepare the competencies of the graduate. Now, from where we get these competencies? We get these competencies by conducting a survey, right? So this survey need to be done by an individual faculty. Like if you are teaching pharmacology, please identify what is required for a pharmacology student, what is expected from a pharmacology student, what is expected from a pharmaceutic student, what he needs to perform after going from here to his job, right? So when he apply for a job in the field of pharmacology, what he needs to perform, what he needs to do there. So those competencies, you please prepare a list, and please identify whether we are giving all of these competencies to the student or not. For this, you can depend on your knowledge, and you can also take the help of the industry partners or the employers. So contact the employer, ask them like what skills they want in the graduates, in the new graduates. So if the employer gives you an idea, that's well and good. And then you also consult the advisors or the senior professionals in that particular field. And of course you also pharmacologist, so you also know about or you also pharmaceutics person or a medicinal chemist, so you know what is the skill required. Prepare a list of competencies first, and based on these competencies, you cross check with your curriculum whether our curriculum gives all these competencies or not, right? So this is the way to prepare the competencies. Once you have the competency, once you identify the competency for the entire study of 4 years of B Farm, or uh, B Farm and M Farm together 6 years, for the entire 6 years, or 2 years separately, it's up to you. So prepare these competencies, convert these competencies into a learning outcome with a verb, attach a verb to it, like explain the mechanism of action of benzodiazepines is one learning outcome, right, which is related to the pharmacology. Similarly, there are learning outcomes you can prepare for pharmaceutics. Now these learning outcomes are prepared based on the competencies, okay, based on competencies. So always the competencies come first, then the learning outcome. Then at each subject level you can prepare the learning outcomes further. You can divide the learning outcomes subject wise also further. They're called CLOs, or subject level learning outcomes, or course level learning outcomes, you can say, right? And finally, topic wise also you can prepare the learning outcome. Like for example, today I am teaching a particular practical. Now in this practical, what is the student going to learn, right? I'm teaching in vivo analgesic activity in vivo, right? So what is the student should learn from it? Identify those learning outcomes, one, two, right? Match it with the CLO, match it with the subject level outcome, and then match it with the program level outcome also for the entire B form, right? And then these learning outcomes are matched to the competencies finally. So if you can integrate the curriculum like this, as a faculty, if you can work on this for your individual subject, identify the competencies first, then identify the learning outcomes, prepare your own subject learning outcomes, make sure that you are giving all this to your students, explaining them to the student, make sure that student learn all of them thoroughly. so that we are not missing anything in between. There are no gaps in between. We are fulfilling all the gaps, right? We are making sure that the teaching is complete 100%, learning is also 100% complete, assessment is also done based on the learning, based on the teaching and learning, and you have the outcome, that is the graduate with 100% knowledge and skill, right attitude, so that he is employable now, right? So with this attitude, if you can work on your existing curriculums, try to do little tweaking, little improvements in that, identifying the gaps, identifying the competencies, making sure that you prepare your learning outcomes based on the competencies, prepare a well structured, I'm sure you can do a lot of improvements in your subject. If you are teaching any subject, you can do a lot of improvements in that. I'm not saying you should not cover, I mean, you deviate from your syllabus. No, I'm not saying that. Complete your syllabus. Please make sure that you fulfill the university requirements. And along with that, make sure that the student is also getting enough competencies so that he can face the real world tomorrow. So make sure that you give him what is required in this particular subject. Now, how to prepare competencies, just we discussed about that. And writing high quality learning outcomes. Okay, now we have the competencies with us. Based on the competencies, you can prepare the beautiful learning outcomes, right? So use the observable verbs, the verbs which can be measured, like explain, compare, calculate, demonstrate, analyze, evaluate, design. These are all observable verbs. There are many books or websites, there are many Google pages available on how to prepare a learning outcome. So, based on the competency, if you can prepare the learning outcome using this observable verb, we can implement this learning outcome. And the student will also understand like what he needs to exactly learn from this practical or from this theory lecture. For every lecture, you can prepare the learning outcome and make sure that you add this learning outcome in your lecture slide. The first slide should be the learning outcome, so that they know exactly what they are going to learn today, what are the what is the skill he needs to learn today or he's planning to learn today. So you can see one example here. By the end of this course or by the end of this subject, student will be able to analyze a patient case and justify an appropriate medication plan. Maybe it is related to pharmacotherapy mostly, or maybe you can say clinical pharmacy related learning outcome. So by the end of this course, students will be able to analyze a patient case and justify an appropriate medication plan. So this is the learning outcome. So exactly the student knows what he is going to do now and what he is going to achieve by doing this task. And accordingly, you plan your lecture, accordingly, you plan your slides, and then deliver those slides. Make sure that the student learn it by conducting a quiz or by conducting a test, a small test, so that the assessment can also be planned, done maybe in the same class or maybe in the next class or maybe at the end of the week or at the end of the particular month, right? So according to your individual circumstances. Okay, so we can prepare the learning outcomes and make sure that these learning outcomes are utilized for better teaching and learning. Now, there is a Bloom's taxonomy. According to the Bloom's taxonomy, there are different types of the levels of thinking we have, right? So there is at the bottom of the pyramid, you can see the knowledge-related learning outcome, like just remembering something, then understanding it. So, what are the verbs we can use to specify this understanding of the subject? Explain, describe, summarize. These are verbs we can use to specify this understanding concept. Then application concept: calculate, demonstrate, use, right? Calculate a particular, do this particular task, calculate this particular task. So you can demonstrate a particular task, right? So demonstrate in vitro activity or demonstrate the effect of atropine on a particular tissue. You can explain this in the learning outcome you can write, and you can demonstrate that practical, and let the student understand it, and he also demonstrated it, right? He also demonstrated that particular task. So this kind of application can also be identified. Application can also be application related learning outcomes can also be prepared. Analysis related, evaluation related, creation related, like designing, developing something. This is mostly related to the research. At the end of the MFORM, at the end of the second year of MFORM, maybe this learning outcome is suitable there. So you have learning outcomes which can be prepared using the verbs which are given here, right? If your most of your learning outcomes are related to just remembering things, most of your exams are related to just remembering things, so you will just produce a graduate who's going to have a knowledge, but he is not having any skill to apply this knowledge. So there will be a gap between the knowledge and the application part. So there is the employability will be reduced, so there will be effect on his employment career. So to improve this, we need to fulfill all these gaps, make sure that he remembers everything. So there are few learning outcomes related to remembrance. There are few learning outcomes related to understanding, application, analysis, and evaluation. So you have learning outcomes to fulfill all these tasks. So when you have all these learning outcomes in your subject, so that now the student can remember things, he can also apply this knowledge, he can also analyze the situation, give the proper solutions, and finally the output of the graduate will be um, more employability, right? So ultimately we are discussing about employment here, right? So how to produce a graduate who is 100% successful, and who is successful in his career, who is employable. So to prepare to prepare that graduate to graduate such kind of a person, we need a strong curriculum with all these aspects embedded into that. So now when you observe this alignment, like your learning activities are aligned with the assessments and outcomes. So these three aspects need to be aligned with each other. So what the student is learning, the same thing is assessed. Based on that, you will get the outcomes, right? So if you are learning something but you are not done assessment, and here I would like to ask, here I would like to ask you one thing. I'm sure you must be aware of this. Assessments drive the education. Assessments actually help the student to be more serious in the learning, right? If you remove all the exams, if you remove the exams, or if there are no exams, or if the exams are very weak, if the exams are not challenging, right? So the student will not learn anything, right? He will not learn, he will not be serious, because he can he can easily pass the exam. Sometimes some of the learning outcomes are not tested also, right? Like we are teaching them something, they are learning also, but you are not applying this in the exam. When you are not using this in the examination, the next batch of the students, they will not read it, they just ignore that particular topic, right? They just ignore that. So every topic must be assessed for its knowledge. Based on the knowledge based questions we need to give, we need to make sure that there are skill based assessment is also done for for every subject. And in every subject, the attitude of the student need to be assessed, need to be examined. So we need to assess all the knowledge, skill, attitude, all of them, or its values also. If it is a research, we need to assess the ethical values, or the plagiarism and other things also, right? So we need to make sure that the student understand the assessments. You have to tell them that this is what you are going to be assessed. At the end of the semester, I will check whether you follow all the ethics and plagiarism policy or not. Then you can even assess the values also, values of the student, ethics of the student also. So the learning activities, the assessments, and the outcomes, they all need to be aligned. They have to be in the same line, they have to be in the same direction, right? So if the learning outcomes and assessments, there is no any alignment between them, then outcomes will also be not aligned, obviously. So the student who graduate from it will not be employable, will not be having the chances of high career success. Now, the assessments are also need to be aligned. Make sure that you include all kinds of assessments in your subject, all kinds of examinations. So you have few MCQs. Make sure that there are few short answer questions, long answer questions. These are all helpful to test the knowledge of the student. And for reasoning skill, you need to make sure that there are some case based assessments, like give a case, give a clinical case, or give a case related to your subject, give a task related to your subject. If it is a pharmaceutics, give a task like, this is the task we have, this is the difficulty we have, please solve it. Then communication related assessments, like how he is communicating, how the student is communicating. Let him give a presentation, let him participate in a objective structured practical exam. There is a practical exam with the rubrics involved in that. For each task he is performing the practical, there is a rubrics involved in that. Based on this rubrics chart, you will assess the each student. Then there is objective structured clinical examination. If there is any clinical subject like therapy, pharmacotherapy, for example, or a clinical pharmacy, for example, in those subjects this is applicable. But if it is the regular traditional B form, so there will be no clinical exam, but there will be practical exam. So it should be an objective structured practical examination. And then observed encounter. Make sure that you observe the student, then you assess him. Practical skills, direct observation, OSPI again. Professionalism, make sure that you observe his attendance, the records he is writing, the portfolio he's building, right, the records and all those things. And how much importance he gave to professionalism. Make sure that he's not doing any plagiarism kind of a thing, or copying, those kind of things he's not doing. And he's well versed in the ethical values, right, of his job role and other things. So this need to be tested as well, right? This can also be done very easily, right? You need to just observe him, and you need to give him a task, let him perform that, give him an assignment, let him submit the assignment, and check for the plagiarism. That is one of the identifications. And then research skill, of course there is a project, dissertation. So he will submit a book to you and he will present it to you. Make sure that he understands the research, like what is research, what are the different types of research, quantitative research, qualitative research, the different types, and his performance in the research, completing his task, right? These are also, he's well versed. These skills also you are going to test. So when you test all this, when you include all of them, then it becomes the full assessment. So you are assessing the student in variety of ways. You are assessing his knowledge, you are assessing his reasoning skills, you are assessing practical skills, professionalism, and so on. So based on this assessment, if the student knows that he is going to be assessed like this, so he will train himself, right? He will make sure that he is ready to face this assessments. Otherwise, he will not be ready, right? If you test his only knowledge, for example, you conduct just theoretical exam, you give him some questions like an short answer question or a long answer question, you're not assessing his practical skill or a reasoning skill or the presentations or the professionalism. So he will not bother to upgrade himself and acquire the remaining competencies which are required for his job, right? So during the stay for 6 years in your campus or 4 years in your campus, make sure that he attains all these competencies, working on himself, based on the assessments you are suggesting, based on the assessments you are planning, right? So tell him beforehand that these are the assessments we have in this particular subject, and you are going to be assessed like this. So based on this, he will develop his himself, he develop his skill, he develop his competencies, so that he can face your assessments Indirectly, it helps him to secure a good job in the future, right? So that he can be highly successful in his career. Now, once the curriculum is done, you are going to map it, make sure that you are giving introductory knowledge. You are providing him a chance to practice again and again, reinforced skill, and then he is a mastery in that particular task finally, right? So you are going to make sure that, for example, there are 4 pharmacology subjects you have in the entire curriculum: pharmacology 1, 2, 3, 4. In all the subjects, you should make sure that, compared to the pharmacology 1, pharmacology 2 provides more better knowledge, better skill, and better attitude. And in the pharmacology 3, it should be better, increased more, right? It should be increased more. So in that way, you can make sure that by the end of this 4 subjects, by the end of this 4, 5, 6 subjects, whatever it is, you can actually make sure that the student is mastered in that particular subject. So student is first introduced to the subject, then he got a chance to work on his knowledge again and again. He practices skill reinforcing, and then he become a master. So mastery he will get. So he is now well versed in the entire subject. So in the left corner, I mentioned some competencies just for discussion. I mentioned them. I'm not saying these are the only competencies you should consider. You can have n number of competencies, maybe 30 competencies you prepare. Here, just I mentioned 4 because of the limitation of the slide we have, right? So I mentioned just 4, and I mentioned just 4 subjects here. But I'm sure you must be having many subjects. Like in each semester, we have more than 6, 7 subjects. So it's going to be more subjects. So if you can prepare both the subjects, as well as if you, in one column, you prepare your competencies, in another column, you prepare your subjects, and then you align both of them, make sure that all these subjects gives you these competencies. If any competency is not available in any one of the subjects, you have to prepare a new subject, you have to give them a new subject, or you have to modify the existing subject so that you can give this competency, or you can train the student in that particular competency. So in one left column, you can prepare all the competencies, 30, 40 competencies you can write. And above you have horizontally, you have all the subjects. So subjects can be mentioned 1, 2, 3, 4, 5, 6, 10, 20, whatever it is. And then you match both of them. Make sure that each competency is addressed in at least 1 or 2 subjects, right? And make sure that each competency is given in all the 3 levels. So competency is first addressed in subject number 1, is an introductory level. Competency 1 is introduced in the subject number 2 also, but in a reinforced level. But in the subject number 3 and 4, we introduce the same competency in the mastery level. So we are giving these competencies in 3 different levels in different subjects. So by the end of the program, by the end of the entire 4 years, 5 years course, now the student is well versed. He's a master of that particular subject. Now you can see pharmaceutical knowledge about the pharmaceutical dosage forms, knowledge about preparation formulations, and so on, is first introduced in subject number 1, that is pharmaceutics 1. In subject number 2, the same subject is reinforced, so the student's ability to perform skill is increased. Now subject number 3 also reinforced, further reinforced. In subject number 4, the student will become master of it. So now the student have a mastery of that particular pharmaceutics or a particular pharmaceutical knowledge. He is the master now. So over the period of the time, during the entire program time, during the entire the 4 years of B Farm or 6 years of B Farm and M Farm together, the student will have pharmaceutical knowledge in all the 4 subjects in different levels. So first he is introduced to pharmaceutical knowledge, then the knowledge is reinforced, again reinforced, and then he becomes master of it. So this is the how actually we need to prepare the competencies and then prepare the subjects and then align them, do the curriculum mapping. I'm sure if you understand it, I think it is very easy to perform. It's not very tough because you have your curriculum with you, and I write all the subjects, pharmaceutics 1, 2, 3, 4. Then here write all the competencies. Make sure that each competency is matched with the subjects, but in different levels. Introductory level subjects, then reinforced level subjects, and the mastery level subjects. And you can find synonyms. You can find the synonyms for reinforced, master. There's no problem. But this is the overall concept you need to follow. But you can have different words to it. You can have different model of curriculum mapping, right? And you can have different number of competencies you can write, and competencies are based on your interactions with the employer. Based on the employer interaction, you have to prepare your competencies. Of course you have the knowledge what is required, and of course you need to contact the employer also, because we are purely academicians, right? We are teaching the students in the colleges. So we are not the employers of the students. So the employers need certain skill in 2026, maybe the AI skill, right? So did we include AI in our curriculum or not? Is it a competency? First of all, if it is a competency, then write in the competency. And in which subject we are giving AI? Are we giving it in subject number 1, or a subject number 3, or a subject number 6, where we are teaching this AI? If you are teaching in subject number 1, but that is at introductory level, just write I. If it is at mastery level, write M, or reinforced level, write R. So you can you can prepare this curriculum mapping, identify the competencies, write all the subjects, and prepare a beautiful map, so you will have a clear idea like what are the lacunas we have in the curriculum, where we need to modify. I'm sure as an individual faculty you can do it. As an individual faculty, if you understand this, you can definitely do this. You can make your own mapping, you can do, and identify all the competencies, make compare it with the subject, and prepare a mapping. Based on this, you can plan your future actions. Vertically also, make sure that you align the curriculum. So in the foundation year you will give knowledge, and application of that knowledge you will provide in the year 2, right? In all the subjects of year 2, make sure that the application part is included, more of application is included in year 2, and analysis kind of knowledge is given in the year 3, and performance is tested in the year 4, right? So you have 4 levels of um, teaching, learning, strategy, assessment. All of them you can prepare based on these 4 levels. So you can test the knowledge, you can test the application part, you can test the analysis part, you can test the performance part. These all you can prepare. These all you can prepare your learning outcomes, prepare your teaching learning strategies, and you can prepare your examinations also. If you are conducting examination to year 4 students, your questions, your planning of assessment, everything should be based on performance of the students in the particular task. So they should be given a task and they have to perform the task. If it is a theoretical exam, give him a case, give him a problem, ask him to solve the problem, explain him the case, and let him solve the problem. So that will be the final year assessments, the fourth year assessments. So the fourth year assessments and first year assessment, there should be a vast difference. In the first year we just ask questions related to the knowledge of the student, and when it comes to the fourth year, knowledge based questions, no, we don't ask him what is the use of aspirin in the fourth year, right? We give him a task like what are the if a patient is suffering, why a patient is suffering from tremors and seizures after using salbutamol, right? So he needs to identify why the salbutamol causes the tremors and seizures in the final year. So the questioning, the way you question is different. even if it is the theoretical exam. Even if it is a theoretical exam, the task need to be given, the case should be given to the patient, and based on the case he will identify the answers for that. So this kind of mastery level question should be given in the final year. So you have knowledge based questions, you have application based questions, analysis based questions. Now why you are now we are only talking about assessments. Now based on the assessments, based on the application of the knowledge, you need to perform your teaching and learning as well. You need to plan your teaching and learning as well. You need to plan your learning outcomes and competencies as well. So they're all aligned with each other, right? So basically we are performing foundation. In the foundation year we have learning outcomes which are mostly related to knowledge. Teaching and learning also mostly related to the knowledge, and the assessments also related to the knowledge. Just a recall question you will give, right? Recall questions. If he knows that subject, he can answer it. Okay. Now, in the vertical integration of, there's an example given here. Like in the first year, you give basic pharmacology. So we'll explain about terminology, kinetics, dynamics, and all of them. And in the second year, we don't explain again PKPD. We don't go back to the
Explain about terminology, kinetics, dynamics, and all of them. And in the
Excuse
second
me, sir.
year, we don't explain again PKPD. We don't go back and explain about terminology, kinetics, dynamics.
So we make sure that the classes of drugs are explained in year 2, application part is explained in year 3, identification of suitable drug and so on, and problem based discussion. And in the year 4, the professional performance of the student is tested, is given to the student. In, I mean, your teaching and learning is based on the professional performance, to improve the professional performance of the student. And in the year 4 we make sure that the student is tested also for his professional performance, like medication review, pharmacovigilance, safety, right? So it all depends on your competency. Again, if your subject is industry oriented, for example medicinal chemist, for example, so obviously competencies are different, the subjects you are teaching is different, teaching learning outcomes are different, but you have to follow the competencies. First you prepare the competency, make sure that you arrange your subjects, make sure that you include all the subjects which are required to meet that particular competency, and then arrange this subjects in different years at different level, right? So there is year 1, year 2, year 3, year 4, and maybe year 5, 6 also if you include the masters. So in the horizontal curriculum integration, we make sure that each disease or each task or each problem is thought or is given in many subjects. Like for example diabetes is as a part of physiology, as a part of pathology, as a part of pharmacology, as a part of pharmaceutics also, because we identify the drugs used for diabetes and how to manufacture them. Those formulation related questions are also addressed in the pharmaceutics and formulations. Medicinal chemistry, of course, and biotechnology as well, because there are human insulin which is manufactured using biotechnological advancements we have, human recombinant DNA technology. So we include diabetes in all the subjects. We make sure that different aspects of diabetes and the drug treatment of diabetes, or the diabetes management is given in many subjects, in all the subjects, like whether it is physiology, pathology, medicinal chemistry, all of them. This is called horizontal curriculum integration. Again, based on the competency, you have to identify this task or the disease or the drug, and then whether it is taught in all the subjects or not. At least in many subjects, many aspects of it is covered or not. We need to identify. Like if the nutrition is not mentioned here, nutrition is also very important for diabetes. Are we teaching nutrition related facts for the treatment of diabetes or not? Please check your curriculum. If it is not given in any subject, please include this. please make sure that it in one of the subjects it is also given, it is also explained to the student, if it is one of your competency. If it is not the competency, it is, you can ignore that. But if you want your student to become well versed in diabetic management, you have to include nutrition also. You have to make sure that nutrition is also given in one of the subjects. Now, you need to identify the gaps first. Make sure that there is no duplication. Again, you are not teaching the same skill or same task again and again in different subjects. Remove the duplication. And then prepare your action plan, remove unnecessary repetition. You can move here and there, make sure that the subjects are properly aligned. Make sure that the horizontal and vertical alignments are properly done, and then you are giving all the competencies you are covering, and then you can fulfill all the gaps. Then you can say you fulfilled all the gaps of curriculum. So this is the alignment chain. So first you identify the competency, prepare your learning outcomes for the entire program of 4 years of B Farm or 2 years of M Farm. Then prepare the subject level outcomes. Then learning activities you prepare, like what are the learning outcomes learning activities uh, we need to provide to the student based on the learning outcomes. Please prepare that. Then prepare the assessment schedule, assessment tasks, like what are the assessment tasks we have, how many times we are doing it, like when is the presentation done, how the presentation is done. Nowadays the presentations, the practical skills, and the thesis, all of them can be measured, because these are all subjective assessments. All the subjective assessments need the rubrics. So the rubrics are available for all these assessments. So you can utilize the rubrics to do the subjective assessments and make sure that the student is thoroughly properly assessed without any deviation. And then feedback, provide this feedback to the student so that he can correct himself in the next year or in the next semester, and he can improve. If the chain breaks, alignment breaks. So high level CLO or SLO requires analysis, but students receive recall lectures. Like a high level SLO, for example, high level subject level learning outcome. If the learning outcome says demonstrate a particular skill or a perform an in vitro experiment, and if you ask questions not related to the in vitro experiment but related to a recall question related to the drug, then we will, I mean, we are not satisfying the learning outcome, and the competencies will not going to be attained by the student. And finally we will have gaps in the curriculum and gaps in the teaching learning outcome and assessment, and you will not have the graduate who is well versed in the subject or well versed to perform his task. Employability will be affected. Now after all this, let's question ourselves, is our curriculum really aligned? Current curriculum, whatever curriculum in your college is currently existing, is our curriculum really aligned? Please question yourself. If it is not aligned, ask yourself, if it is not aligned, then how to improve. Then you have to start from competencies. Make sure that you prepare the competencies for your subject, and then are we giving this competency? Please make sure to identify that. If not, please add this in one of your subjects, and then prepare your learning outcomes according to the competency. Test that learning outcome at the end of the semester. How many students learn it? Please test it, right? So in this way you can improve the employability of the person. So when he graduates, when he comes out of your college, he is now able to perform his skill really well, right? So this alignment, curriculum alignment, help us in improving the employment, right? So the key message is start with competencies. First identify the competencies. How to identify? You have to speak to the employer. Identify an employer who is employing your graduate, or the people who are working there, or the senior people who are conducting interviews in the organizations. Ask them questions like what you see in the student, what you test in the student, what he needs to do after come to your organization. So please ask them, so that for a pharmacology M.Pharm, these are the competencies required. They will give you a list. You ask some of these, surrounding you, like 4, 5, 10 people. Collect this information. If you can collect this online, that is much better, because you cannot contact them physically. So you can do this online. Ask them to send you some competencies that they look into the candidate, and merge them, prepare the list of competencies now. Then write measurable learning outcomes. Based on the competency, prepare the learning outcome. Then do the alignment with teaching and assessment. Then mapping the curriculum, build vertical and horizontal integration. Then check if there is any gaps further and fulfill those gaps. Make sure that you have a robust curriculum, because curriculum is number one pillar to build uh, the quality graduate. To build a quality graduate, that curriculum is number one pillar, the first pillar, you can say. A strong curriculum always drive the student to learn better, perform better, and to settle better in their careers. So a well-aligned curriculum develops, integrates, and assess what students need to become competent professionals. So make them competent professionals. We have to start from identification of competencies, prepare your curriculum, prepare the learning outcomes based on the competencies, and make the robust curriculum so that you can help your students to perform better in their lives. So this is about my presentation for today. And if you have any questions, please write in the comment section, and I will try to answer them if I have a time. Dr. Udayveer, actually, the competencies are based on your subject.
Dr.
Thank you.
Udayveer,
Yeah.
actually, the competencies are
Yes, sir. Yes, ma'am. Any questions? Anything you want to ask me?
Okay. Thank you, sir, for your session regarding the competencies. It's a wonderful session for all the faculty, how to satisfy the students, how to improve the knowledge of the students and all.
Yeah.
I request our principal, sir, to talk. Yes.
Hi, sir. Wonderful speech we had it just now. Very useful, not only for the, that means, so once if you are parallel training the staff means it will be useful for all the staff also. When teaching to the students, it will be useful for us. So a lot number of points covered. So very beautiful, very slow passion. That means your teaching is also very good. Easy to listen. That's most important. Easy to understand, easy to listen also. And any questions? Just I'm checking, sir. So I think very good. People are appreciating like anything informative and useful session. That's it.
Thank you, sir. Thank you so
So
much.
it's all done in this Saudi, sir, in your colleges.
Yes, sir.
Syllabus is old only.
Yes,
Or
sir. Exactly.
they're
Yeah.
also they're revising, sir.
Yeah, every 5 years we do the revision of our curriculum, and it is done, like we spend around 1 year time. First, we start with the need assessment. We speak to our employers, we speak to our alumni, because our alumni are employers basically. They employ our own students sometimes. We speak to our alumni, and we also have very good connection with the employers, most of them. So we speak to them online, and we understand what is required, what are the gaps they identify. Like they give us their stories. Like we conducted some interviews recently, we found these gaps, the students are not performing well, they're not able to do this particular task, why you are not teaching them, right? They ask us. Like one of the things we recently identified is pharmacovigilance. Like one of them employer said, we have pharmacovigilance department because it's compulsory according to the government regulation to have pharmacovigilance departments in all pharmaceutical industries. So when we want the students, when we call for the interview, most of them come without any knowledge in that area. They have no idea to operate softwares related to pharmacovigilance. So that's a real lacuna we identify. So we included one subject immediately in Form D program, and we also started one MSc in pharmacovigilance recently, pharmacovigilance and clinical
Good,
research. So the students are
good
trained
idea.
in that particular skill, and when they go for employment, they will be obviously employed well because they are given exactly the same candidate. The candidate is like based on the competencies we identify from the employer.
Even I think when it is autonomous or separate university, we can
Yeah.
divide the syllabus like anything.
Yes,
That is
exactly.
PV, regulatory affairs, and medical
Exactly.
coding. Each semester
Yeah.
one subject, if we keep it, they'll be
Yeah.
master once they complete the course also. It will be good.
Exactly, sir. And first we need to
Mm.
identify who is our employer and what is the skill required for the to fulfill that employer needs, and then prepare our syllabus according to the employer requirements so that the students can be employable. Otherwise we'll end, and it depends on the local situation also. Like if the college is in Hyderabad or in Ahmedabad where you have cluster of pharmaceutical industries, most of the students go to the industry. So you can prepare
Yes.
your syllabus industry oriented, and the employability will be higher. Like if you do not have any industry nearby, and if the employment is mostly the pharmacist in a government hospital or a railway or some other jobs, then of course you need to modify your curriculum to include some of the topics to face those exams in the future. So the students is now employed like that. So it depends on the local situation. Hmm. I live near to Makkah because this place is very near to Makkah. Makkah is a very pilgrim place, and maybe millions of followers come here, millions of the for their religious purposes. So this particular reason, they need people who understands the pharmacists, the nurses, the doctors who understands this pilgrim related or the problems, the health related problems which are associated with the large mass gathering of pilgrims. So we included a subject based on that.
Okay.
That is, yeah, that is because that's related to the local situation. Maybe in other cities it is not required because they don't have any much gatherings, big gatherings. Like colleges in Tirupati or colleges in that Kumbh Mela, Ahmedabad, and all those places. Maybe they need to think about this handling pilgrim situation, big number of people. Yeah,
Even the syllabus is revised in such a manner, sir.
yeah.
Many points are included which are useful for the daily life. Even it's included in yoga also
Mm.
in the PCS syllabus. So students will be trained like anything in the while study. Generally, yoga means we go in the morning session 6 to 7 like that.
Yeah.
But now it's a part of curriculum. So it will be very much useful. So let us
Wonderful.
make the students a good citizen
Yeah.
in the future.
Alternative medicine, like having a good, I
Yes.
mean, having good knowledge in alternative medicine, like Ayurveda, homeopathy, like the basic knowledge of it, just to know what are the drugs, what are the systems they have, like Vata, Pitta, Kapha, those systems of Ayurveda, if they learn the basics of it at least, and the dilutions in homeopathy, those systems. So that basic knowledge, if you can include, that's wonderful.
So
Thank you so much, sir. Thank you.
that's good, sir. Good, sir. Thank you. Thank you very much.
I have a question.
One question is there, sir.
Yes, sir.
Some Devadasu Chapal asking one question. How to get integrated these horizontal and vertical pharmaceutical analysis?
Yes, sir. So in pharmaceutical analysis is given in many subjects, maybe, right? Maybe given in one or two subjects, or maybe more than that. Like if you specifically, if you have two, three subjects in pharmaceutical analysis, Make sure that you identify the competencies, and these competencies related to the pharmaceutical analysis, like GC, HPLC, what competency we see in the student in UV operation. You list those competencies which are required, and how many subjects we are giving these competencies, like in 1 2 3 subjects. Are we covering all the competencies? Are we covering enough of GC, enough of HPLC, enough of the UV or not? Right? Please make sure that you are covering all the aspects. If the employer requires something, please include that also. Maybe they have more information, better information than us. Maybe they need something more different than what we currently teach. So include that competency, and make sure that you have all the competencies met in different subjects. Like in subject number one, we are teaching about UV, IR, and all. Subject number two, we are teaching about HPLC, and then maybe in GC, right? So the student also perform, first understand the UV, then he also perform it either in the same subject or in the different subject. So we are aligning the subjects with the competencies, and we are also making sure that student is understanding the knowledge and also performing it. So if we can do both of them, then we can fulfill both horizontal and vertical integration.
Question, sir, it's like Sagarika, in current scenario, what skills pharmacy students should develop for good employment, especially pharmacology students, both M.Pharm and B.Pharm?
Pharmacology traditional curriculums, those students who come out of traditional curriculum of pharmacology, they are employed by the research, R&D, pharmaceutical industries. So we need to speak to the employer, like what is the skill required, like in vivo, in vitro, bioassays, is it currently conducted or not? Do we need any pharmaceutical analysis skill also for the pharmacology student to perform HPLC, for example? Or do we need any therapeutic drug monitoring related skill for the pharmacology student? Please ask the employer, and the employer will list you these are the skill I'm looking in the pharmacology person. So please list them as the competencies, and try to identify whether your curriculum is offering these competencies or not. So as far as I know, it was basically the in vitro, in vivo experimental skills, the knowledge about the pharmacology of different systems, and then bioassays and so on. So these are all we are giving currently, right? If there is anything missing, please list them also based on the employer feedback.
Udayveer Sara is asking one question, sir. In horizontal mapping,
Yes.
example, general pharmacy, which competency has to be mentioned? I don't think pharmacological research or professionalism has to be a test
Uh,
in
Pharmaceutical or a
horizontal map.
yeah, like in general pharmacy, like general pharmacy subjects, I think what
Pharmaceutics,
I understand, yeah, general pharmaceutics. Okay, if it is pharmaceutics, then what are the competences required, like the formulation related, or the different, like tableting, capsules, manufacturing of syrups? I think we are all giving these competencies already. Like we have them in our
yes.
theory, we have them in the practical. But speak to the employer. Maybe he needs something more, maybe he needs something different. Say if a pharmaceutical industry person, if he needs a skill for in a pharmaceutics person, if he is looking for a particular skill in a pharmaceutics person, he will explain you that I need a person who can make who can work in injectables as well, sterilized products as well. But often I see some students who are not having any knowledge in sterilized products, they are attending the interviews. So please improve on this, so he will tell you. So please emphasize more on sterilized products or injectable preparation, right? Spend more time on that. Give more time to that. Maybe add few more lectures related to injectables, so that the graduate will have a better skill in facing the interview tomorrow, particularly in that area as well, right? So if you are spending just 1 hour or 2 hours on that in theory, spend more on that, maybe 4 5 hours, so that you can fulfill that competency. So the patient, the student will become more employable, right? And because you are fulfilling the competencies, if it is related to pharmaceutics.
Yes.
So that you need to speak to the first employer, then check your own curriculum. Am I giving this properly? If you have this in curriculum, but if you are still, if the graduate is not having enough competency, even if it is included in your curriculum, then there is problem in the infrastructure, problem in the teaching delivery of your lecture, problem in learning process or the learning of the particular task. Probably even though you are teaching it, but you are not assessing it, so they communicate with their seniors, and the seniors will tell them that it is not going to be assessed. You don't need that. You don't need to read about that, right? It's not going to come in the exam, so don't read it, right? So the student
Yeah.
will not learn it. You understand what I'm saying? So assessment is also compulsory. The learning happens through assessment. Learning is assessment driven. So if the assessments are not done properly, if you're not including all these topics in assessments, then they will not learn it. They just ignore that particular topic. Probably that is happening. So even though you include this in the competencies, even though you are teaching it properly, even though you have infrastructure for that, but still the competency is not achieved in the graduates, that means the assessments are not based on your teaching and learning. Assessments are not based on your competency. So there is a gap there. Fulfill that gap so you can produce a better graduate in the future.
My suggestion, sir,
Yes.
to the faculty also, pharmaceutics faculty. There's one book authored by the Ansel, the pharmaceutical process formed by Ansel. It is full of not only theoretical part, assessment also is there. Problems are there, assessment is there. Resolution is delayed. What best, what alternative you have to do it? Or syrup is there. Preservative is missing. Which one you have to add? What percentage you have to add? Like this Ansel book is very good for teaching the pharmaceutics, particularly for general pharmacy, for first year students. Ansel. So generally, other books are not like that. Even Lackman also, the problems are very less. But Ansel book is excellent in this type of logical courses. Any more questions, sir?
Sir, not a questions.
Questions, sir? Okay. One question by our faculty.
Yes, sir.
Good afternoon, sir. Very good afternoon, sir.
Good afternoon, ma'am. Good afternoon, ma'am. Please tell me.
Actually, it is a very wonderful informative session, sir. Today, I mean, regarding to the whatever criteria is happening nowadays. So it's very good, sir. My question is that how far means so many employers will be there. For example, as you said in Hyderabad, most of the people will go for industries, right? So
Yes, ma'am.
industries, we are having so many departments like QA, QC, formulation, production, packaging. So many departments will be there.
Yeah.
So if we opt them, I mean, if we go and ask them what knowledge or what criteria we have to meet to enter into their industry, so they will give a very big list, no, sir. So
Yes,
how
ma'am.
far it is possible to implement in an institution, because we can't inculcate all the competencies in a single subject or in a single semester, because in practically we are having only 3 months,
Yeah.
3 or 4 months semester means.
In a
So
semester,
in a
yes.
semester or in an
15
academic
weeks.
year, so hardly we'll get 60 or 60 classes, right? So in these a very short term period, whatever the list they has given us, and along with that, the foundation is also very necessary for our students, right?
Yeah,
So if we
exactly,
want to incorporate all these things,
ma'am.
is
Yeah.
it practically possible, and how far we can achieve that?
That's a very pertinent, very important question, ma'am. In my opinion, there is no other way, because ultimately we are producing the graduates for employment, right? So if he is not employed, there is no admission in the future, right? So if there is no employment, there is no admission. So it is linked to our jobs basically. So make sure that you speak to at least few of them, like your alumni. You can speak. Make sure that you speak to the your own classmates who are working in the industries, and learn from them. I mean, ask them like, what are the competencies we need, like what you see in our graduate. When a graduate come to you for the job, what is the requirement from you, right? What questions you ask in the interview? or what task you give to perform, so that you can plan your curriculum, so that you can teach the same, you can include that in your current curriculum. Now, can we include everything in one semester? Definitely not. So we have to include this in the whole 4 years program of B Farm, or a 6 years overall, like B Farm and M Farm together. So we make sure that the graduate, like a pharmaceutics graduate, for example, pharmaceutics postgraduate, what is the skill required to have? To have a good employment in a good industry. Please ask the pharmaceutics employer, or a pharmaceutics in charge, or a head of the department of formulations in one of the industries. So he can guide you, he can tell you about the competencies. I'm sure you already know the competencies, your curriculum is already well prepared, well structured, you already have very good knowledge on that. But we are trying to learn from the employer, because there is a huge changes happening time to time, huge modifications happening. So they must be having a different employment criteria now, not the same like 10 years back or 5 years back. So ask them these questions, include those small changes in the curriculum, or small changes in the competencies, so that we can have a better employable graduates. So it is like tweaking the curriculum, modifying the curriculum a little bit, so that we can make our curriculum more robust, so that they can perform well in their jobs in the future. So we have to work for our students. There is no other way, because it is the only way we can know. Otherwise, if you don't ask them, there will be huge gap between the college and the industry. So the
And the
employer,
industries.
yeah. So this gap need to be reduced. I'm not saying we have to listen to them completely. No, I'm not saying that. I'm only saying listen to them and then try to implement as much as possible.
Okay, sir. Thank you so much.
Thank you so much, ma'am. Yeah.
So,
So hope I answered the questions. If there is anything,
Yes, sir.
you are welcome. Yeah.
Nothing.
Thank you so much,
Nothing, sir.
Doctor.
Thank you
Thank you
for
so
your good information for us. Everyone has get this knowledge to how to reduce the gap between industries and academic and all. Thank you, sir. How to we will
Thank
also improve these competencies.
Thank you so much,
Thank you.
ma'am. It's my pleasure. Thank you.
Thank you all. In any questions remaining, anyone? Madam, sir, kindly share your PPT, sir.
Yeah, sure, ma'am. Definitely.
Okay. Thank you, sir. Thank you for
Thank
your wonderful session.
Thank you. Thank you.
Thank you all for joining the session today. We will continue our session for tomorrow also. Sagarika. Sir, one more, sir.
Yeah, please.
One message here from Sagarika regarding suggestions. In colleges, the placement cell deal with the companies and call them for recruitment drive. Subject teachers, if they are involved in this process, maybe it will be benefit students more, as they can implement the requirement of the employees.
Yeah, that's a very good suggestion actually, because if the subject teacher involved in this, so he can work on his subject, she can work on her subject, and make sure that whatever curriculum ask, whatever the curriculum says, the current curriculum says, we can teach all of them. I'm not saying we should modify all of them at once, right? So you can teach all of them exactly, but along with that, you also can include some of the competencies which are currently missing in your curriculum, in your syllabus. So make sure that you can get this idea, or what is missing, you can know from your interactions with your employer. Maybe the employer is your own student, maybe your own alumni, or maybe your own senior, or your classmate is an employer. So identify them. It's not very tough, because nowadays, we have social media, we have the LinkedIn, Facebook, and so on. You can contact them easily, and out of 10 people, at least 2 3 of them will answer you. So from that, you can get an idea, right, what to include, how to improve our curriculum, how to make our curriculum more stronger, so that our students can benefit from it. And then if the curriculum related issues are fulfilled, then think about your teaching and learning. There are many courses which are related to improving the teaching and learning. There are courses conducted online as well, right? I'm sure you must be aware of all this. So try to improve yourself to learn more online about teaching and learning, what techniques we can use, how to improve our presentations, how to use AI for improve our presentation, how to engage the students, how to conduct a group discussion, how to conduct an objective structured practical exam, how to conduct a presentation, what are rubrics, how to prepare our rubrics, how to validate our rubrics, right? How to evaluate the thesis, what are the components for the evaluation of research skill or the thesis. So these all things we can learn online. So once you learn this online, once you fulfill this teaching learning requirements, the competencies, then think about your assessment examination, how to conduct examination, how to prepare a question, like how the question should be written, right? Like what are the verbs we can use, then what are the models of questions we can use, what are recall questions, what are analysis based questions, what are reasoning based questions, what is the difference between them. Once we work on these aspects, our teaching will be improved, obviously our assessment skills will be improved, and then finally the graduates who come out of your institute will have a better employment. That's the outcome, the final outcome. So your suggestion, I completely agree with you, Dr. Sagarika. You can definitely contact your employers, make sure that you learn as much as possible from them. Thank you.
So the book name is what I used to suggest to my students and staff and all. Answers Pharma Dosage Pumps and Drug Delivery Systems by Lloyd Allen, Nicholas, and Lippincott Williamson. In this book, generally, we see all the problems in the name of capsules, exercises, case studies. It's a very good book for the students and not only for students, staff also. Logical questions and even problems also. It'll take some time to think about all these things now. Generally, they give the information, it's over, but not like that. This book is having a lot number of problems also. So it's a problem-based learning. It will be useful for the pharmaceutical staff mainly.
Wonderful, sir. Wonderful. Very good
Wonderful,
information.
sir.
Yeah. Thank you so much, sir. Thank you.
Thank
Thank
you,
you.
sir.
Thank you all. Thank you so much. Thanks for listening. Thank you, sir. Thank you.
Sessions.
Thanks.